Probably you've heard that heart disease is the number one killer of women. I hope you've heard that. But did you know that heart disease is also the number one killer of new moms in the United States? That's pretty shocking information. And there's 6 pregnancy complications that can cause a threat not only in pregnancy, but also later in life, according to a scientific statement from the American Heart Association. My guests today are Dr. Nisha Parikh, who is an associate professor of internal medicine, or I guess of medicine, at the University of California, San Francisco. She is a cardiologist with an interest in women's cardiovascular health, including during and after pregnancy. And also, we have a mom from Tacoma, Washington, Monique Shields. She developed high blood pressure while pregnant with her first child. That was 21 years ago, and she's still working to keep her blood pressure under control. Welcome to both of you. I'm so glad you're joining me for this conversation. Really, most pregnancies are uneventful except for the aches and pains, anxiety, and all of those things that go along with this. But in 10 to 15% of cases, pregnant women experience complications, 6 of which are closely tied to risks for heart disease and stroke in later life. Dr. Parikh, first of all, congratulations. I understand you're the chair of that committee that wrote that scientific statement, and I know what an undertaking and what an accomplishment that is, so congratulations on that. Can you just briefly explain these pregnancy complications that we're talking about?
Yeah, sure. Certainly, and thank you for the congratulations. I also wanted to just acknowledge the writing group members because this really was a group effort, as are many things at the AHA. I think congratulations goes equally to them as well. But sure, getting back to the 6 pregnancy complications that we want women to be aware of that could put them at increased risk for cardiovascular disease. I think first and foremost, high blood pressure during pregnancy. And that would be defined as having a blood pressure of 140 for the top number or 90 for the bottom number after you've gone through 20 weeks of pregnancy, if you've had normal readings previously. This can also include a preeclampsia, and that would be the same high blood pressure, but with signs of damage to the liver, kidneys, or any other vital organ. So kind of that combination, that's also called toxemia. Mm-hmm. Another pregnancy complication is gestational diabetes, and that's the onset of type 2 diabetes during pregnancy in women generally that don't have it before. Having a preterm delivery puts a woman at increased risk, and so that means having your childbirth before 37 weeks. Another risk factor that hasn't been very well known before is placental abruption, and that's separation of the placenta from the uterus before you give birth. And that condition can put you at increased risk. And then finally, having a stillbirth or a death of a baby prior to delivery or recurrent miscarriages can put you at risk.
Thank you for that. Well, let's focus today on high blood pressure and preeclampsia. Monique, you had preeclampsia. Tell us about your experience. What did you feel? When did you notice? What happened?
Well, I had no symptoms that I felt. I was working all day, came home early to go to a doctor's appointment. Mm-hmm. And it was just my regular monthly doctor's appointment. So summertime, threw on my flip-flops, walked out the door to the doctor. And of course, when you get there, your blood pressure's taken. And I recall the nurse saying it was extremely high. I don't remember the numbers, but I know, excuse me, they were triple digits on the top and the bottom. Mm. So she had me lay down for a while in a dark room and see if my blood pressure would go down. And probably after about 20 minutes, it did not. I think it might have went up a little bit. And so she asked that I go over to a hospital that was just a little bit away. And she said that I would be monitored for my blood pressure. So I'm thinking I'm going to be in the emergency room with a cuff on my arm. But I get over there and they have a wheelchair and they're ready to whisk me off. I'm like, I don't need this, because I felt totally fine. Yeah. I didn't have any symptoms that I knew of. Maybe a little bit of swelling in my feet, but that's to be expected summertime and I'm pregnant.
Mm-hmm.
So they admitted me into a room and I, again, felt fine. I wouldn't say I saw spots in front of my eyes until probably 2 or 3 hours laying in the hospital bed. So later on that evening, my doctor came in and he said, you are extremely sick and you're going to have that baby tomorrow. So the hospital I was at didn't handle high-risk pregnancies. So they sent me in an ambulance to another hospital about 10 miles away. And I get there and they said, we're going to put you on bed rest for 3 days. And it was strict bed rest, couldn't even get out to go to the bathroom. And they said, we give you steroids to help the baby's lungs. So that's indeed what happened for 3 days. And then the third day they did induce me. I did deliver, no complications. My son was a preemie. I had my 35th week of pregnancy in the hospital.
Did your blood pressure come down right after you delivered?
No, not at all. Not at all. So I had to remain in the hospital an additional 3 days. And even if I wanted to go see my son, I had to be wheeled down there. Once I left the hospital, I was put on high blood pressure medication. But other than that, it never went down. So I've had it for the last 21 years.
Did you had your blood pressures been fine and all your visits before then and before you got pregnant? You know?
I never had high blood pressure issues. You know, it's been 21 years and he might have said it was a little high at some points, but nothing like that appointment at 34 weeks.
Yeah, I'm so glad you both ended up fine with that.
Yeah, I was so grateful I had a doctor's appointment that day. You know, who knows what would have happened.
Dr. Parikh, let's talk a little bit, listening to Monique's story, about what's the difference between high blood pressure in pregnancy and preeclampsia? What made them decide it was preeclampsia?
I think increasingly the distinction between the two is probably getting less and less firm. But we usually think of preeclampsia as high blood pressure during pregnancy that has signs of any sort of end organ damage. And so that could include, again, signs of damage to the liver, the kidneys, or another organ. And I'm sure that women, when you're pregnant, you notice that we're always checking the urine to look for protein, because that's an easy way to check if there's any sign of damage to the kidney, because it's spilling more protein than usual. So that's one way that we monitor it in pregnancy. And then just high blood pressure during pregnancy, that's also called gestational hypertension. And that's really the onset of high blood pressure during the pregnancy at the numbers we mentioned, greater than 140/90. Or it's there's also a form of chronic high blood pressure before the pregnancy that gets worse during the course of the pregnancy. All of those things can put you at risk for having high blood pressure later, of course, and cardiovascular disease if the high blood pressure isn't treated subsequently.
Is it unusual for a woman's blood pressure to stay up after this? Does it sometimes come back down to normal after the baby's delivered?
It can. In some women, we notice sort of like, a gradual decline of the blood pressure back to normal. And we don't really notice that she develops high blood pressure right away. But we know that, and then in some women, it sounds like Monique, in your case, you now have high blood pressure. And so in some women that preeclampsia is sort of that first sign that they're stepping into the category of having high blood pressure, hypertension. So there are definitely different ways that this manifests. There's also a category that we worry about, which is postpartum preeclampsia. And that's worrisome because oftentimes there's sort of this window after delivery and before you go for your 6-week postpartum appointment, where you could develop preeclampsia actually after delivery. And that's always worrisome to us because you're not really under close hospital monitoring anymore or clinic monitoring. So that's another form of preeclampsia that we worry about too.
And I noticed that Monique mentioned that she had some swelling of her ankles, which, she attributed to, oh yeah, it's summertime, and of course that's happening. But that can also be one of the signs, correct?
Absolutely. Thanks for bringing that up. That is a sign. If you have swelling in your legs or in other parts of your body, that could be a sign of preeclampsia as well. And I think, to be on the safe side, I don't want every pregnant woman to think that their swelling is due to preeclampsia, because I don't want to cause worry in mostly normal pregnancies. But I think that with the availability of blood pressure cuffs, either at home or in the drugstores, and sort of in several places, there's easy ways to monitor blood pressure now, and so I'm really optimistic about women being able to distinguish between just normal swelling and if they're having high blood pressure that they're not aware of.
I do want to talk a little bit about women of color, because we know that women of color have higher incidence of these complications in pregnancy. And we've seen some very high profile women. I mean, Serena Williams, who would be in better shape than Serena Williams, Beyonce, that they have had these issues. Let's talk a little bit about pregnancy complications in women of color.
Yeah, so one of the sections of the statement that I think was really important and unique was we had a pretty large section on race ethnic differences in these pregnancy complications. And so what we do know is that women who are Black, Hispanic, or Asian tend to experience more adverse pregnancy outcomes, such as the 6 that we spoke about. And they also have a higher burden of cardiovascular disease risk factors, either before or after the pregnancy, and cardiovascular disease events compared with white women. So it's definitely, these Black, Hispanic, and Asian women are at higher risk. Yes.
Do we know why?
Yeah, so a lot of our studies, unfortunately, have not really concentrated on these high-risk groups of women, but we are learning more. And at least right now, one of at least I can speak to Black women who have been studied in a little bit greater detail than Asian or Hispanic women. We know that the risk factors, the pre-existing cardiovascular risk factors, don't necessarily explain a large degree of their elevation in adverse pregnancy outcomes. And so we're starting to recognize that there might be factors such as structural racism, as well as distrust in the provider-patient relationship that might be affecting the risk more. And we want to study this further, start to understand it, and then tackle it, because I think this is really going to be our best way to decrease the burden of adverse pregnancy outcomes and then ultimately cardiovascular disease in women. So I'm really hopeful about this.
That's very, very important. Monique, did you have any idea or any awareness of any of these kind of complications when you were deciding to get pregnant and became pregnant?
No, not at all. The resources that we had 21 years ago just didn't exist. I remember reading What to Expect When You're Expecting. I might have just skimmed over that part about preeclampsia. I didn't even know what preeclampsia was. I couldn't pronounce it. I had to keep asking my husband, what's it called again that I have? So no knowledge at all.
And Monique, you had other pregnancies after this first one. Did you have high blood pressure during pregnancy?
Right. Yes, I had my second son 5 years later. Mm-hmm. And I was monitored very, very closely from the beginning. I had a blood pressure cuff that I had to take my blood pressure at home. Mm-hmm. And then my job was extremely stressful at the time. And so my doctor didn't like to hear that. So he took me out on leave 2 weeks before my delivery date. And I thought, oh, good, this will give me time to get ready for the baby. Oh no, I was on bed rest for 2 weeks. I was like, honey, I'm so sorry. So I was on bed rest 2 weeks before and actually induced 1 week before. So I was watched very, very closely.
And a healthy baby and healthy mom?
Healthy baby, still had high blood pressure though.
Mm-hmm. And is your blood pressure controlled? Have you been successful in controlling it?
I've been successful in the last 5 years. It's been 21 years. And just as the doctor said, you know, moms are extremely busy. I had a newborn preemie baby. That was my priority. And then just adjusting to all of his appointments and getting him healthy, and then working, and 5 years goes by and have another child. And you know, my health was not a priority. I wasn't taking my high blood pressure medication consistently. And so it's just been in the last 5 years that I really, you know, had a lifestyle change and said, I need to get it together. You know, there's family history of heart disease. My dad died suddenly of a heart attack. My mom has heart disease now. So I just felt like I had one foot in the door for having a stroke.
Yeah, I really want to thank both of you, Dr. Parikh and Monique, for this wonderful conversation. It's been a whole lot of fun being with you today. A lot of great information. I'm so glad that you had a good outcome, Monique, even though I know that was terribly stressful, anxiety producing, and also very challenging when you brought that baby home, et cetera. But glad your blood pressure is under control. Everyone out there needs to do what Monique did. It's a great plan, she said, with her exercise, her eating, her taking her blood pressure medications. All of those things are important because you don't need to have a stroke. You don't need to have a heart attack. You don't need to have congestive heart failure. Those are not things that you want on your calendar. So please, please make a difference.